Thank you for staying with us. The greatest self-inflicted damage is living in self-denial. The Nigerians' COVID-19 situation on our minds. Nigerians have abandoned COVID-19 protocols despite the detection of the Delta variant, which is regarded as a highly contagious strain of the virus. Despite the discovery of the countries last week, Nigerians disregard COVID-19 safety rules remain unabated, and there are fears that this will lead to rapid spread of the dangerous strain. So, time to return to the drawing board. All non-pharmaceutical protocols, we seem to have lost our guard, the momentum, and right now we are talking about that Delta variant, that deadly variant.
Well, I was quite happy towards the end of June when the figures from the Nigeria Center for Disease Control comes in daily. I was quite happy because at some time, though all the figures were not were said to be incomplete that day, June 27, we had only 2 cases. And that appeared very encouraging. But then, all of a sudden, we saw from June 30 up, it started rising until we had 186, and then today, 154. I believe that this 154 that we spoke about today will also include the Delta variant. But beyond even the Delta variant now, this figure itself is not good enough because it means we are losing the gains we recorded already. And whether it is for lack of enforcement or even Nigerians getting excited about not having someone enforcing the rules, we've lost it. We've lost it.
Even at the height of everything,
we've lost it.
The only places you get to see people observing the safety protocols, Lagos, Abuja, and some other major towns like that, at the height of COVID, a lot of Nigerians still believe that there's no such thing. That, come on, you know. So when it subsided, they were like, you see, we told you this was just irregular malaria that people were treating, and you guys are raising alarm.
Yeah, a lot of skepticism, attended the COVID-19 health challenge, and within our clients, I doubt if that has changed much. The fact of the matter is that we have lowered our guards, no doubt. And those of us who have been tracking the Center for Disease and the Nigeria Center for Disease and Control, did reckon that we could get to this point, especially with the emergence of the Delta variant. Remember, experts had always warned that this virus was going to mutate, at some point, and that's why we have had, different variants of it. And if you also acknowledge the fact that some parts of Africa, have had to deal with this variant, you could tell because of our porous borders that things like this, would happen. So yes, we lowered our guards, and the facts and figures that we have out there are really not very encouraging. A recent report that we did on our platform, suggested that between January and July this year, the number of deaths, attributable to COVID-19 had risen by 62%. And these were data that we gathered from the Nigeria Center for Disease Control. So it shows you that things are not really looking good in terms of adherence to COVID-19 protocols. You hardly find people, wearing their face mask. You hardly find people observing social distancing. You hardly find people in most places, observing the very basic routine, of washing their hands. So the figures don't look good. And if between January and July this year, we have recorded a 62% rise in deaths attributable to to COVID-19, then we should be worried about the Delta variant, which we hear is even deadlier. And we have bad reports. And remember, we also don't have a very good record of testing around here. So even when our colleague Dr. talked about statistics, we should be worried, because even those figures that have been bandied around may be far, far higher, because we are not even testing enough. So it's a major challenge. And I think that what we can say, at a forum like this, is to encourage Nigerians, wherever they are, both high and low, to ensure that COVID-19 protocols are still being enforced. And people should just realize that, appreciate the fact that the world is going to contend with this disease for a very long time to come. The global figures are also not looking very good. You understand? If you look at Latin America, Brazil, Turkey, and the rest of them, same challenge.
Even the US.
And we should just do what is basic, adhere to those basic rules. And that's why, those of us who live within the Lagos area would commend what the governor had done. There was a quick response to it, and we wish that other state governors would also take the lead, to create that level of awareness and ensure that the rules are enforced. Enforcement is key if we are going to be able to contend the COVID-19 pandemic.
It's as if right now that you are on your own. The way it was addressed when the first and second wave came out, and there were isolation centers, government was spending money, testing people, taking care of people. Now most of those isolation centers now they're closed, and nobody's ready to spend anything on you do it yourself, and it's as if you're just on your own now.
Well, I don't think it's as if we're on our own. In Lagos, for instance, what we have seen is, if you are not keeping people in the isolation center, why do you want to leave them open? These isolation centers don't run on inverters. They run 24/7 on diesel generators. You must keep staff there. So if you are not, when they are not doing anything, you are still paying them allowances. And the way we run in this country, it will get to a point, those who are doing nothing will get into a group and say they are going on strike for not receiving COVID-19 allowance. Those are the old things. I mean, a few of the things we need to look at when we are talking about closing them down. Fine, there may be a need to reopen. But the way it is now, all over the world, people are being treated right in their homes. It's just for you to ensure that you use whatever medicines you are given at the right time, right quantity, and all the rest. And also, like Sam said, we need to begin to pay attention to enforcement. For instance, the figure Governor Babajide Sanwo-Olu gave included about 18% of those who arrived from abroad not being traceable. No working number, no nothing. So it means what we have done is, these 18% are mixing with the society, and if any one of them had any issue, they keep spreading it.
Okay, I have my first caller. Diamond is calling us from Kaduna.
Hello, good evening.
Good evening, Diamond.
Okay, I would just like to say that this particular case.
Diamond, please try and come back.
If you look at it now, if we are not careful, Lagos is going to explode. Because if those people pass through Lagos indeed,
and they are not caught.
And we are leaving them.
From the airport.
From the airport. Look at it, Lagos still tops, as of today, 60,638 cases. And like Sam said, for me also, my belief is these are conservative figures. Because we are not doing enough testing, and there are so many people who have on their own recovered. And in the process, they are good. So if we are not careful, indeed, we are going to lose it. If we can, at the airport, international airport, lose passengers into the system and we are not able to trace them, I can imagine that will also have happened in Abuja. It would have happened in Kano. And I think, like Sam said, we need to watch it at that level. Otherwise, we're going to lose it.
Olushola Julius is calling us from Oyo State. That's Ibadan in Oyo State.
Yes, thank you, Ayo. Good evening.
Good evening. Thank you for joining us.
The analyst in the house, good evening.
Good evening, sir.
I'm Olushola Julius from Ibadan, Oyo State capital. Now, we want to appreciate the effort of our people in power for what they have done. But we will still need them to do more. I think the governor of Lagos State, someone said something last week that about 9,000 people have mixed with the congregation of the people in Lagos, and they are still searching for them. They are not traceable. And these people are enough to spread it even to millions. So we want to encourage them to put more effort, although the economy cannot be shut down the way it was done in early 2020. Why? Because for now, Nigerians are depressed already economically, and the security situation is not palatable. But at least we will need them to put out some kind of stringent arrangement that will make Nigerians comply, so that at least life can continue with Nigerians. And again, this virus will not overwhelm us. Thank you and good evening.
Thank you, Olushola. Now, I've taken my first jab. I've taken my second jab. Yeah. Should I be afraid of this Delta variant? One. Number two, University of Lagos, the management came out to say they've been experiencing students in their health center coming to complain about flu-like,
Okay, your first question, should you be, worried whether you could risk, an infection after 2 jabs? Okay. I'm not an expert, but I've read reports, about people, succumbing to the virus even after 2 jabs. But I want to pray and wish that you don't go through that experience. But that's the way of this virus. We don't have 100%, report in terms of performance of the vaccines that have been out there. And I was going to come to that because it's a major concern for us as a country. This afternoon, before I set out, for this forum, I heard that we had just vaccinated a little below, I think we had 4 million vaccines, which we have practically exhausted.
3.9 million.
3.9. That's
Are you sure we exhausted this? Because I was told some of them even got expired.
No. Listening to very senior officials of the government, health officials, they said they had attained 98%, vaccination rate
of 3.9.
Yes.
6 million.
Remember there were 2 jabs. So you had 2 million for the first jab, and then remaining 2 million. And the reports which we want to believe that has been shared by them is that they attained a 98% success in terms of number of persons that have been vaccinated. But Ayo, you want to place that against the population of Nigeria. Just 2 million, about 2 million persons out of a population of
200 million. It's just like
you want to
look at the percentage.
You want to ask, what is government strategy towards getting Nigerians vaccinated? We are relying on the rest part of the other parts of the developed world, and you have what is now referred to as vaccine nationalism. Those who don't want to share. So again, borrowing from Dotu, we seem to be at the mercy, of this disease. We just hope that the government is able to find a solution to it, whatever it will take to get Nigerians vaccinated and keep the citizens healthy and safe. We don't have a choice but to do that.
I have Drew Jai from our Papa in Lagos. Thank you for joining us.
Hello.
Yes, go ahead, please.
Mr. Ayo.
Yes.
Mr. Ayo, good evening.
Good evening, Drew Jai.
And thank you for doing it. And thank you for doing a very good job. Can I go on?
Let's go on, please.
Okay. While appreciating what Governor Sanwo-Olu have done in Lagos State, my appeal still go back to him that please, sir, don't leave us at the mercy of this pandemic. The isolation centers that are closed should be reopened. Please. That's just my own contribution. Thank you very much.
Mr. George, I'm sure the governor is watching. He watches journalists and that. The governor is watching and that's noted. And do we have information about this isolation center? I know of IDH.
What we should consider is the economy of keeping those places open. Because it is agreed. Resources, income is dropping. Federal, state, local government, rapidly. So you cannot afford to put all your money into buying vaccines. And even when you have the money, you have to queue. We are just trying now to get the World Health Organization to approve a laboratory for Nigeria for production of vaccines. If we get that approval, are we going to throw all our money into it? So what we should be looking at, like we have been saying to ourselves, is we should go back and do what we need to do as individuals. Put on your mask, wash your hands, observe all the protocols.
Yep.
That's what we should be focusing on. And true is that it has gone, whatever happens at that airport in Lagos has gone beyond the Lagos State Governor. It's a federal airport, an international one, manned by officials of the federal government.
I don't get.
And we should be careful in laying the blames on the governor.
No, I don't even get.
Yes,
because as at December last year, if you are coming into Nigeria, the situation was so foolproof that if you don't pay 50,000 naira,
it really wasn't, because people were even coming in with fake certificates.
That means you are from Nigeria.
They were coming in with fake certificates, and there were people who arrived in our system and did not go back for this test 2-3 weeks after, whereas they were supposed to go back in 7 days. What happened to them? What safeguards do we have in terms of ensuring that these people they go back for checkup? Sam.
I left O'Hare Airport around the 8th of January, and it's kind of mandatory before you could leave Chicago at that time. $134, as in it's even the one you wait for 3 days.
Yeah.
And when you wait, conduct it compulsory. And as you're coming into Nigeria, you are asked for the federal government receipt and everything.
It's about control. You and I know that we have always had gaps in the area of implementing, decisions of government. There has always been that gap. But again, we must admit that this is not a Nigerian problem. I've read reports. In fact, one was done by a colleague of ours in South Africa, where COVID-19 certificates were being hawked.
Yes, on the streets.
Yes, on the streets.
On the streets.
So I just hope it's not a problem that is linked primarily to developing countries like ours. But we need to checkmate all that. It's about control. It's about implementing government, rules that have been made in terms of, protecting citizens.
And let me add to that the reality now should dawn on us that we should not only be planning for today and tomorrow. We should be planning for 5-10 years. That's what we have lost.
That's COVID.
Because if we
has come to stay.
Beyond COVID, if we cannot get a laboratory that is approved to produce a vaccine now in Nigeria, as hyped as our name is,
especially against the background of what we now know, how countries that have capacity are holding it, and have made up their mind to take care of their citizens first.
To be your, if you
even
you do contrary. All right, we take